Good evening, everyone. My name is Claire, and our project is all about developing a voice pathology diagnosing tool. And this tool is all about figuring out what's wrong with someone's voice or discovering the root cause of the voice disorder in individuals. And it is mainly empowering the communication for the people with the voice disorders. And here are our key partners. We have the hospitals that will use our tool to analyze the patient's voices that are having voice disorders in order to know the root cause of them, and the AI researchers and the NGOs and the cloud providers that, since our tool is assistive communication system assistive, and it is also deployed to cloud, so there are important partners. And the key activities, we have the data collection, and our data we used is a data set, audio data set that consists of the pathological audio recordings and the recordings that are clear. And another one, we have the model training and development, and some of the techniques we used while developing and training our tool or model is the sparse learning, that is all about extracting the relevant features like the abnormal jitter while ignoring the irrelevant variations like the background noise, reducing the computational costs, and that enhances the model interpretability for the communications. Then deployment via the hanging face, and testing and validation with real users, and also user training and support and marketing and awareness campaigns. And the key resources are the proprietary datasets that provided the audio signals which were used to train the model, then the cloud infrastructure where our tool or model was deployed to, and AI engineers for developing the model, and also the medical experts that provide the voices that are used to train, test the model, and the funding and the research grants, funding and research grants that aid the development of the model through, yeah. And the value proposition, our tool enables early detection and intervention, like early detection of the voice disorder, and it enables and also the cost reduction through, like, it reduces the payment made to the clinician every time, since R2 is seamless, like it is accessed via the smartphone, so it is easy for a person to detect the voice disorders without going to the clinician. And another one, have the potential integration with the existing speech assistive devices. Yeah, since it is deployed, it can be accessed through the smartphones. And our customer segment have the individuals globally with voice disorders, the healthcare providers like clinicians, hospitals, therapists, doing manual work, and parents and caregivers of children with voice disorders. And our channels where our tool can be accessed from, we have the web platform and API, the healthcare partnerships, the partnerships with our cloud providers, and the social media awareness campaigns. And our customer relationship, partnerships with the voice diagnosing therapy institutions, like we can help them keep in touch with them. We can help our customers keep in touch with easily in case they use our tool with therapists, and community engagement and automated tools. And And our main revenue streams are through subscription licenses for the clinics and the therapists, and also making advertising whenever the person is using our our tool. There are some advertisements that are whenever someone is using our app, there are some advertisements that advertising usage fee, the fee that is paid by everyone that uses our tool, and licensing and the AI model for assistive tech companies, and the government or NGO funding for accessibility, helping those ones that are suffering with the voice disorders, but they can't really afford the data maybe. So that's where the government comes in. And our cost structure have the fixed costs on salaries to the AI engineers, speech therapists, sales staff, cloud infrastructures, and the variable costs that are data collection on data collection and processing, marketing campaigns, and user training. Thank you.